Hi guys, it's me, Professor D, and welcome back to my channel. On this video, I'm going to be covering pediatrics. Now, I already know you guys are going to be typing away on the computer. Hey, Professor D, we need some more. So I'm going to make this a part 2, maybe even a part 3 series. We'll see how many questions I get through, but I know you guys really love the specialties, the psych, the OB, peds. So when it comes to the specialties, I will definitely make sure I cover more than one video for you, okay? If you haven't done so already, please be sure to like, comment, and subscribe below. First question. The nurse is working in the ER of a children's medical center. Which client should the nurse assess first? 1, a 1-month-old infant who developed colic and is crying. 2, the 2-year-old toddler who was bitten by another child at the daycare center. 3, a 6-year-old school-age child who was hit by a car while riding a bicycle. 4, a 14-year-old adolescent whose mother suspects her child of being sexually active. And I'll give you a moment to think of your answer. And the correct answer is 3. Okay, why is 3 the most critical patient? This patient got an MVA. We're worried about their physiologic integrity. Remember in my priorities video, I taught you about physiologic integrity, what actually keeps that patient alive. If they were in an accident, they might have internal bleeding. They might be hemorrhaging. So we're going to check that patient first. The other patients all can wait, but that MVA is a life-threatening. Anything that puts a patient's physiologic integrity at risk means that it's life-threatening. The patient may die. We have to see them first. Next question. The 8-year-old client diagnosed with vaso-occlusive sickle cell crisis is complaining of a severe headache. Which intervention should the nurse implement first? 1, administer 6 liters of oxygen via nasal cannula. 2, assess the client's neurological status. 3, administer a narcotic by IV push. Or 4, increase the client's IV rate. And I'll give you a moment to think of your answer. And the correct answer is 2. You're going to check the client's neurological status. So let me tell you something. Whenever a patient has, it didn't even say a headache. It said a severe headache. And what kind of patient are we dealing with? A patient that has sickle cell and they're in vaso-occlusive crisis. What does that mean? That means those RBCs started sickling up. Instead of being nice and round, which means it's flowing nice and easy, they start stickling up, right? They start stickling up, which means they're going to start clumping together. And so what are we really concerned about here? A stroke. That's what we're concerned about. Matter of fact, let's say the patient was not a sickle celler. Patient had hypertension and they say they have a severe headache. We're still worried about a stroke. So the first thing we're going to do is rule out a stroke, because if the patient had a stroke, you know, as long as it's not a bleeding stroke, right? What are we going to give that patient? TPA, and we want to give it within 3 hours. So this is time sensitive. That's why you have to make sure that it's not a stroke, and that's what you're going to rule out. That's the first thing you're going to do. The very second thing you're going to do, you rule out stroke. What are you going to do? Not give oxygen, increase fluids. Let me explain this to you. The reason that the patient's RBC starts to sickle, then they start to clump together, right? A big reason that happens is dehydration. That's why you tell those sickle cellers to always carry a bottle of water with them. Make sure they stay out of the heat. If they have to be in the sun for any reason, make sure they're staying hydrated. Okay? So the minute you hydrate that patient, those same RBCs that started to sickle and start to clump up together, they take their nice round shape all over again, and it's free flowing. You want to give them oxygen, great, but you better do it after you give them fluids, because there's no point of giving them oxygen without giving them fluids. Let me explain why. The problem in that patient that has sickle cell crisis is not that they don't have enough oxygen. They have enough oxygen. The oxygen is in the RBC, right? What carries oxygen in RBC? The hemoglobin. So it's not a question of having enough oxygen. The client has enough oxygen. The problem is that the RBCs start to sickle, and so the oxygen is not getting where it needs to go. So you can give them oxygen nasal cannula all you want, but it's not going to help the problem. If you really want to help the problem, you're going to give them fluids. The minute you give them fluids, the RBCs go back to a circle shape, and then you have free flowing blood. All right. So the reason in this question we didn't choose fluids, we chose neuro, was because of the severe headache. Severe headache, remember, if those RBCs are sickling up, there's a high chance the patient could have a stroke. So you're going to rule out CVA. But if you don't see any choices about the CVA, your first thing you're going to do is going to be fluids. After fluids, you can give the patient oxygen, okay? FYI. Next question. The nurse is caring for clients on the peds unit. Which client should the nurse assess first? 1, the client diagnosed with type 1 diabetes who has a blood glucose level of 180. 2, the child diagnosed with pneumonia who's coughing and has a temperature of 100. 3, the child diagnosed with gastroenteritis, potassium level of 3.9. 4, the child diagnosed with cystic fibrosis who has a pulse oximetry of 90%. And I'll give you a moment to think of your answer. And the correct answer is 4, the pulse ox of 90. Guys, you want the patient's pulse ox to be 98 to 100, okay? If it's 95, we're not happy about it, but it's way better than being lower than that. We don't want anything lower than 95. Some books say 95, most books say 98. We definitely want it up there. So the lower that the pulse ox is, that's the less saturation of oxygen that's happening in the blood, okay? Airway. So this is what's most important to us. You're going to run to that patient first. Who are you going to run right after that? Is the patient that's a type 1 diabetic and their blood sugar is 180. Why? Because if they're a type 1, their pancreas is shot. It's dead. The pancreas is not producing any insulin whatsoever. Okay? You see the type 2s, their blood sugar will be up, but at least the pancreas is working a little bit. So they'll shoot out a little bit insulin here and there. But your type 1s aren't shooting out any insulin at all. So if they don't get an exogenous source of insulin, that means the outside source of insulin, that means you, the nurse, go to the patient and give them the sub-Q insulin, they're not going to get it and they're going to die, obviously, right? However, there's something I want to point out to you. ABC, airway comes first. So a patient with the low O2 sat, you're going to go to them first before you go to the patient that their blood sugar is high. That's number 1. And number 2, I want you to remember when a patient's blood sugar is high, their body has certain mechanisms that they'll compensate for a while before the compensation stop working. So when the blood sugar is too high, they'll start to urinate a lot. They're doing what? Spilling sugar in they're spilling glucose in their urine. So that kind of helps them bring the blood sugar down a little bit. What else? They get thirsty. They start drinking a lot of water. That helps them dilute the sugar a little bit. So the body at least has a little bit of compensation can do to give you a little bit of time to get to that patient. But the patient whose O2 sat is 90, they're in trouble. They're going to go down you very fast because they need that oxygen to survive. That's why the O2 sat goes first, and then immediately after, you're going to go to that type 1 diabetic whose blood sugar is too high. Next question. The nurse has received morning shift report for clients on the peds unit. Which medication should the nurse administer first? 1, the 3rd dose of aminoglycoside antibiotic to the child diagnosed with MRSA. 2, IV push steroid Solumedrol to the child diagnosed with asthma. 3, sliding scale insulin to the child diagnosed with type 1 diabetes mellitus. 4, stimulant Ritalin to a child diagnosed with ADHD. And I'll give you a moment to think of your answer. So guys, come on. I just talked to you about this, so I hope you chose the correct answer. The correct answer is 3. That child that's a type 1 diabetic and their blood sugar is too high, all right? If there was another choice in here that a patient had problem with airway, you would have chose the airway, but we don't have any problems with airway, right? I hope you were not tricked by choice number 2, the patient who needs the Solumedrol for asthma. Yes, asthma is a breathing problem, right? But it doesn't say there's anything actively going on with that patient right now that they're in distress, right? By the way, there's something going on right now that patient were in distress. What would we be giving that patient? Albuterol, a short-acting bronchoagonist, right? So the first person we're going to go to is our type 1 with their blood sugar too high. Then immediately afterwards, we're going to go to our asthma patient. We're going to go ahead and give them the steroid to make sure that they don't end up getting any breathing problems, okay? Third, you're going to go to the patient who needs the antibiotic, patient sick. This is their third dose, okay? They can wait a little bit. And then last, we'll go to the patient who needs the ADHD med. And the reason for that is they need the ADHD med, they're hyperactive, but that never killed anyone. So that's why we're saving them for last. Number 6, the nurse enters the client's room and realizes the 9-month-old infant is not breathing. Which intervention should the nurse implement? Prioritize the nurse's action from first to last, 1 to 5. Okay, so you have 1, perform cardiac compression, 30 to 2. 2, check the infant's brachial pulse. 3, administer 2 puffs to the infant. 3, determine unresponsiveness. I'm off a number. And the last one is open infant's airway. I think I skipped one. But anyway, so I'm going to give it to you in order, okay? So the first thing you want to do is determine their unresponsiveness. ATI. The A in ATI is assess, right? Determine the... Can you imagine you starting CPR on a patient and they're actually breathing and you thought that they weren't? Assess them. Guess what? If they smile, if they coo, if they yawn, if they scrunch up their face, they're breathing, ladies and gentlemen. So the first thing you're going to do is look at them. Are they breathing? Assess them to see if they're breathing, okay? So number 1, you're going to determine their unresponsiveness. If they're blinking at you, they're looking at you like this and they're blinking, guess what? They're breathing. So anyway, number 4, that's the first thing you're going to do. You're going to assess the unresponsiveness. And the next thing, after you realize, whoa, they really are unresponsive, they're not breathing, the very next thing you're going to do is number 5. Open up the airway, open up their mouth so you can give them oxygen. And that leads us to number 3, administer 2 puffs of oxygen. After you open their mouth, you're going to give them the oxygen. Next, after we gave them the oxygen, we're going to check their brachial pulse. We want to see if their heartbeat is beating. And if we have no pulse, that means the heart's not breathing. What are we going to do last? Compressions, okay? So your order is number 4, then number 5, then number 3, then number 2, then number 1. Next question. The 3-year-old client's been admitted to the peds unit. Which task should the nurse instruct the UAP to perform first? 1, orient the parents and child to the room. 2, obtain an admission kit for the child. 3, post the child's height and weight at the head of the bed. 4, provide the child with a meal tray. And I'll give you a moment to think of your answer. And the first thing the CNA or the UAP is going to do is number 1, orient them, okay? This is not teaching, this is just orienting. So the CNA is going to say, this is the bed, the bathroom's here, the sink is here, the emesis basin is here. Orient them, because just orienting them is going to decrease their anxiety, so then you can do what you have to do. So everything else the CNA can do, but that's going to come later. The first thing you're going to do is orient them, okay? Next question. The nurse is writing a care plan for the 5-year-old child diagnosed with gastroenteritis. Which client problem is a priority? 1, imbalanced nutrition. 2, fluid volume deficit. 3, knowledge deficit. 4, risk for infection. And I'll give you a moment to think of your answer. Okay, guys, the correct answer is 2, fluid volume deficit. Again, if you recall in my priorities video, I went over all the different types of patients that were a priority, that physiologic integrity was at risk. And fluid electrolytes is on that list, okay? If a patient's fluid electrolytes is down, guess what? That patient may die. So let's think about what's happening here. Patient has gastroenteritis, so that means they've got vomiting, they got diarrhea due to some kind of infection, whether it's bacterial or viral. They've got infection going on, and that's causing them to lose their fluid and electrolytes through the vomiting and through the diarrhea. So what we're most concerned about is going to be fluid and electrolyte imbalance. Let's look at our other choices. You have number 1, imbalanced nutrition. Nutrition is not the problem. The problem is not anything going in. The problem is too much coming out from the top and the bottom. So number 1's wrong. Number 3, a knowledge deficit. No, that's not a problem. And guess what? Even if knowledge deficit was a problem, remember, Physiological integrity always takes priority over knowledge, over teaching, over pain, except for certain circumstances, which I talked to you guys about that in my other videos. So that's not the answer. And then you have risk for infection. Well, it's not risk for infection. The patient already has infection. That's how they got gastroenteritis. They already have a bacterial or a viral infection that is causing them to excessively vomit and have diarrhea. So the correct answer is your fluid and electrolyte deficit, your fluid volume deficit. Number 10, which data would warrant immediate intervention from the pediatric nurse? 1, proteinuria for the child diagnosed with nephrotic syndrome. 2, petechiae for the child diagnosed with leukemia. 3, drooling for a child diagnosed with acute epiglottitis, 4, elevated temperature in a child diagnosed with otitis media. And I'll give you a moment to think of your answer. Okay, guys, so before I tell you what the answer is, whenever you guys see they ask you which one needs immediate intervention, which one needs clarification, which one needs follow-up teaching, what they're really asking you is which one is wrong, okay? They want to see if you know which one is wrong out of the choices. So for this question, choice 3 is the one that is wrong. Choice 3 is the one that you're going to go to first. Choice 3 is the one that we have the biggest problem with. A child that has epiglottitis and they're drooling. What are we worried about? We're worried about their throat closing up and patient not having an airway to breathe. Remember ABC, airway, breathing, circulation, right? There has to be an airway in order for the patient to breathe. ABC. So that's our biggest problem. That patient that has epiglottitis and now they're drooling, okay? They can't swallow that spit. We're worried about airway. Let's look at our other issues. You have number 1, proteinuria for the child diagnosed with nephrotic syndrome. We expect to see that in that disease process. It's not good. We want them to be treated. But if a patient has nephrotic syndrome, we expect to see protein in the urine. 2, petechiae for a client with leukemia. Same thing. It's not good. But if they have leukemia, we expect to see that. Why? Those platelets are decreased, right? Then you have 4, elevated temperature in a patient with otitis media. Well, it's infection in the ear. We expect for them to have a fever. So number 3, though, that's a problem. They have epiglottitis, okay? Now we see drooling. That lets us know that airway's closing up and we have to get to that patient immediately. Next question. Which client should the pediatric nurse assess first after receiving the morning report? 1, the 6-month-old child diagnosed with bacterial meningitis who's irritable and crying. 2, the 9-month-old child diagnosed with tetralogy Fallot who has edema of the face. 3, the 11-month-old child diagnosed with Ray's syndrome who's lethargic and vomiting. 4, 13-month-old child diagnosed with diarrhea who has sunken eyeballs and decreased urine output. And I'll give you a moment to think of your answer. Okay, guys, the correct answer is 4. This is who we're worried about the most. This tiny little body, and look what it says. It's a 13-month-old child diagnosed with diarrhea, so they're losing what? Fluids and electrolytes. Remember, base comes out the butt, right? So they're losing fluids and electrolytes, and they have sunken eyeballs. What does, excuse me, I'm sorry. What does sunken eyeballs tell us? It tells us dehydration, fluid volume deficit. So there's a double whammy, and then it goes on to say decreased urine output. Let me explain this to you guys. And I've said this to you a couple times in a couple other videos. Whenever a patient gets really, really bad, one of the first things that shut down are the kidneys. Why? The kidneys are the gatekeeper to the body. So whenever something's wrong, the kidneys, they clump up. The kidney's like, I don't know what's going on, but whatever we got, we're holding on to it. We're not letting anything go. So here you have a patient that's going through dehydration, and so the kidneys try to compensate. How do the kidneys try to compensate? By just shutting down. It's trying to hold on to the little bit of fluid that it has left. That's why you see urine output go down, because the kidneys are shutting down. How do you know kidneys are shutting down? The urine output goes down, and the BUN and creatinine go up. So all of those are signs and symptoms that something's severely wrong. Patients going through dehydration, they're losing their fluids, and the kidneys are trying to compensate by shutting down. That's why you see the decreased urine output. You see the sunken eyes because of the dehydration, okay? Something else I wanted to bring to your attention. Again, guys, you're going to see this theme over and over and over and over again, that fluid volume deficit threatens physiologic integrity. And remember, physiologic integrity is anything that can threaten to kill the patient. So that's who we're going to be running to first. Next question. The pediatric clinic nurse is triaging telephone calls. Which client's parents should the nurse call first? 1, the 4-month-old child who has had immunizations yesterday and the patient's reporting a high-pitched cry and a fever of 103. 2, an 8-month-old whose parents reporting the child's pulling on the right ear, and has a fever. 3, the 2-year-old child who has a patent ductus arteriosus, whose parents report running out of digoxin. Or 4, 3-year-old child whose mother called and reported that her daughter may have chicken pox. And I'll give you a moment to think of your answer. And the correct answer is 1. You're calling this parent back first because this is who you're worried about the most. Okay, so you have a 4-month-old who just got their shots yesterday, and you teach the patients when you teach a parent, when the patients get their shot, that they may expect a low grade fever. What's a low grade fever? A temp of 99, maybe 100.0 or 1. And for that, what are they going to give? They can give ibuprofen, they can give Tylenol, depending on what the nurse practitioner or the physician prescribes, but it's never going to be aspirin, right? No, it's going to be Tylenol or ibuprofen, but it's going to be a low grade fever, not a fever of 103. No, this is a true reaction. This is a problem. Okay. We expect a low grade fever. And let me tell you something. You see that heart, what did it say? High pitched cry. When you see or hear a high pitched cry in a child, you're running to that child. Okay. Because you hear a high pitched cry, we're thinking something's wrong with them neurologically or physiologic integrity. Something's going on with that patient that we got to get to immediately. That's who you're running to. Okay, let's look at our other choices. You have choice 2. Oh, right ear infection, duh, it's an infection. We expect them to have a fever. You're going to call them back, but that's not priority. That's definitely not a priority over the high-pitched cry and the fever of 103. Next choice, they ran out of digoxin. Okay, they need refills. You're going to call them back, but they're not going to take priority over the high-pitched cry and the fever of 103. And lastly, the suspected chicken pox. Yeah, that patient's going to have to be seen. Until they're seen, you're going to have mom have that patient in isolation, but they don't take priority over that patient with a high-pitched cry and the high-grade fever, which is 103. Next question. Which child requires the nurse to notify the doctor? Let me go back. Which child requires the nurse to notify the healthcare provider? Oh, that is a question. Okay, 1, the 1-year-old child with iron deficiency anemia who has dark colored stool. 2, 3-year-old child with PKU whose parent does not feed the child any meat or milk products. 3, 5-year-old child with rheumatic heart fever who's having a difficult time breathing. 4, the 7-year-old child diagnosed with acute glomerulonephritis who has dark tea-colored urine. And I'll give you a moment to think of your answer. And guys, I know you know this answer because I talked about this too many times. So you know the correct answer is going to be 3, the one that has difficulty breathing. Because who cares about anything else if that child's dead? If that child can't breathe, they're going to die. So difficulty breathing definitely threatens that child's physiologic integrity. And you're going to keep hearing me say that phrase over and over again. Physiologic integrity. Anything that keeps that patient alive, you're running to. Fluid and electrolytes, glucose, nutrition, airway, vital signs, right? Circulation, hemorrhage. Anything that keeps that patient alive or threatens to kill that patient, that threatens their physiologic integrity, you're running to that patient first, okay? So obviously the correct answer is number 3. Let's look at our other choices. We have number 1, a 1-year-old with iron deficiency who has dark colored stool. Well, the reason the stool is dark is because they're taking iron. What does iron do? Iron is so dark, you teach them to drink it with a straw because it can what? Stain your teeth. And just like it can stain your teeth, right? As it's ingested and it goes through your GI tract, when it comes out the other way, it can cause your stool to be a dark color, right? What else do we need to know about iron? Remember, if you're giving it intramuscularly, because remember, iron, it's not given sub-Q, right? It's given IM, and you better make sure you use the Z-track method. When you're giving iron, you're going to give it Z-track method if you're giving it IM to make sure it doesn't stain the skin, and you want to make sure you seal it in. What are some other important things for you to... Oh, you got to know this about iron. You're going to teach a patient to take it on an empty stomach, take it in the morning with orange juice. Why? The sorbic acid that's in orange juice, right? That's citrus. The sorbic acid is what activates the iron and to make it absorb. So you're going to teach them that. So anyway, that's why number 1 is not the answer. Then you have choice number 2, the patient with PKU, the parents don't give them any meat or milk products. Well, that's a good thing, right? Because that patient that has PKU, they don't have that enzyme to break down phenylalanine, and phenylalanine is found in meat and milk products. So that's a great thing. What else do you have to know about PKU? Patients with PKU, they don't have those enzymes to break down the food. Remember? Oh, I thought I was choking. Okay. They don't have the enzyme to break down the food. So guess what? They have to get an exogenous source. How? Every time they eat, even if it's a snack, it doesn't have to only be breakfast, lunch, dinner, even if it's a snack, anything that they put in their mouths that has to be digested, they have to sprinkle the enzyme on that food because they don't have the enzyme to break the food down. Remember, enzymes. Food doesn't get broken down in your stomach, gets broken down in the small intestine. That's where those enzymes, your natural enzymes, are supposed to be secreted. But the patients who have PKU do not have those enzymes. So that's why those patients have to sprinkle the enzymes on their food so that when they eat the food, it can get broken down. And then, oh, something else you got to remember about the PKU. Those enzymes, remember what I told you it does? It breaks food down, right? So a patient has to be careful. They can't get those enzymes around their lip or what? They're going to see their lip start to peel off because it's going to start eating away at their lip. Next choice, what was the last choice? Oh, patient with glomerulonephritis that had dark tea-colored urine. Well, the reason they have the dark tea-colored urine, what's turning that urine that color are the protein casts. So that's what gives it that dark tea or Coca-Cola colored urine. All right, guys, last question. The charge nurse has assigned a staff nurse to care for an 8-year-old client diagnosed with cerebral palsy. Which nursing action by the staff nurse would warrant immediate intervention by the charge nurse? 1, the staff member performs gentle range of motion exercises to extremities. 2, the staff nurse puts the client's bed in the lowest position possible. 3, the staff nurse takes the client in a wheelchair to the activity room. Or 4, the staff nurse places the child in a semi-Fowler's position to eat lunch. And I'll give you a moment to think of your answer. And the correct answer is 4. The staff nurse places the child in a semi-Fowler's position to eat lunch. Why is it this answer? Because they're asking us which one's the wrong thing to do. Remember I told you whenever they're asking for further teaching, clarification, further intervention, what they're really asking you is which one's the wrong thing to do. And in this question, number 4 is the wrong thing to do. That child has cerebral palsy. They need to be sitting up all the way because we don't want them to choke or we don't want them to aspirate. Everything else, choices 1, 2, and 3 are all wonderful things you want to do for that child that has cerebral palsy because that's helping keep that child, that patient safe. Okay? All right, guys, I've already hit my 30-minute mark. I can't believe it. But anyway, I already know, guys, you're going to be typing away. Professor D, we need more peds. This is going to be my part 1 out of a 3-part series. So I've got lots of peds questions to come, okay? If there's anything besides peds you'd like to see covered, as always, be sure to hit the comment section and let me know, and I'll make sure I make a video for you. As always, guys, and thank you so much for supporting me, for sharing my videos. Please don't forget to like, comment, and subscribe below, and I'll see you next time.